Good evening and welcome to the fifth annual Men's Health Summit here on blackdoctor.org. I'm your host this evening, Shamika Rhymes, and I am thrilled to kick off tonight's important conversation. So let me know in the chat where you are watching from. Let me know how you're doing this week so far. So as we honor Men's Health Month this June, we're shining a light on the health issues that matter the most, especially those that often go too unspoken or untreated in our communities. Remember, also share this with your network because you have no idea who may need it. So make sure, just go ahead and hit the share button and make sure you share it. So our first panel this evening is all about sleep apnea. It's a serious but underdiagnosed condition that can silently impact everything from your heart health to even your relationships, your energy, and even your life expectancy. So tonight we are joined by two incredible experts. First up, we've got Dr. Funke Afolabi Brown. She's a triple board certified sleep physician and the founder of Restful Sleep MD and the best-selling author of Beyond Tired, a sleep physician's guide to solving your child's sleep problems for good. Let's bring on Dr. Afolabi Brown. Hi, welcome.
Hi, thanks for having me. It's
Good
good
to
to see
see.
you again.
Yeah, it's good to see you. For those that don't know, we had a conversation back in March on Celebration, so you can still go check that one out too. Um, we've also got Dr. Roger Washington, a family physician based in Silicon Valley and medical director of the Sleep to Live Well Foundation. He is also the author of Lack of Sufficient Sleep Matters. Let's bring on Dr. Washington.
Hi, thank you. I'm pleased to be here.
Welcome. I see San Jose in the chat, Gastonia, Asheville. Welcome, everybody. And if you guys have questions at all tonight, as we go through even, this panel or the next, please drop those questions in the chat. These experts are here to answer your questions. So let's kick this one off because I think we got to get to the meat of the matter, which is what is sleep apnea and how is it diagnosed? And I think we'll split this one up. We'll start with you, Dr. Afolabi Brown. What is sleep apnea?
Yes, absolutely. So this is the bane of my work in my clinical practice. So sleep apnea is actually a serious condition. It is defined as difficulties breathing during sleep, leading to pauses in breathing, as well as snoring. And it is known to be more common in males, particularly Black males. So that's just a quick definition of what it is. It has a lot of consequences, which I think we're going to be talking about.
Absolutely. Dr. Washington, can you tell us how it's diagnosed?
Usually when people have difficulty with fatigue during the day, or perhaps a family member has told them that they're concerned about the way they breathe, they make a lot of noise, it seems to be unusual. When people display circumstances like nodding off to sleep while they're driving, or in other circumstances where they shouldn't, and it's believed that maybe there's a sleep problem. A doctor can order a sleep test. Now they can be done at home even, where a person will be sent a kit that they can put together themselves that measures their breathing, and then they send the information back, and the doctor can diagnose that they actually stop breathing for 10 seconds or more for more than 10 times an hour, and then they would be said to have this diagnosis of sleep apnea, and it can be mild, it could be severe. The idea though is that some people have snoring and they're only a little bit tired, but when they reach the level where it's interfering with their life, then we diagnose it as what's called sleep apnea with the polysomnogram or sleep test overnight.
Okay. Thank you. I had no idea you could do the sleep test at home. I think I've heard so many people saying they didn't want to go get the sleep test because they didn't want to sleep somewhere else and be uncomfortable and feel like people are watching. But we'll get more into that in a second. But Dr. Afolabi Brown, what are the different types of sleep apnea and how do they differ?
Yes. So we have sort of like two major types of sleep apnea. There's what we call obstructive sleep apnea, which is the most common. This is the one where, there's an obstruction. Think of it, an obstruction in the airway. Usually it's related to that upper airway collapsing, which is why one of the risk factors is, being either overweight or having a large tongue or sometimes facial differences. So that's obstruction, meaning obstructive sleep apnea, meaning that you're trying to breathe, you're making the effort, but you're just not able to get the air to come in because there's a collapse in the airway. That's one. The second type is what you call central sleep apnea. And this we feel is really neurologic. It's really starting from sort of the brain not sending signals to even take that breath. And so we see these differences in the sleep study. So this the sleep study is what really helps us to figure out if it's obstructive sleep apnea or if it's central sleep apnea. There's one more. The reason why I said maybe three is what we call sleep-related hypoventilation or obesity hypoventilation syndrome. It's still sort of in that same category as obstructive sleep apnea, but this is when you start to get a situation where the carbon dioxide in the blood really starts to get to very high and dangerous levels, especially when people have had troubles with breathing with their sleep apnea for a very long period of time.
Or are there some symptoms that go along with each of those?
Yes.
If for those that are listening that maybe trigger that, I need to go get checked because this is happening.
Yes. So there's some symptoms, but I think at the end of the day, what helps us differentiate is that sleep study. And again, the most common, like I would say over 90%, probably close to 95% would be the obstructive sleep apnea. You will never go wrong getting that sleep study. And the symptoms with of obstructive sleep apnea, like Dr. Washington said, is, that snoring. Again, you can imagine as your airway is collapsing, you're not getting air in. And so that will create that vibration. Eventually, especially as you get to certain stages of sleep, things really just do collapse and close up. And then you can hear the gasping, the snorting, the pauses. Those are really, or sometimes night sweats. Sometimes teeth grinding, we see that also. And so those are sort of nighttime symptoms. And many or sometimes you're not aware because you're sleeping. You may just wake up feeling tired because your brain literally was up all night trying to keep you from, stopping breathing. But most times it's either the bed partner that notices those very scary symptoms. But what you would wake up with, or what the kind of symptoms you would have during the day, is unrefreshing sleep. Imagine trying to go to bed or trying to sleep and feeling like you're suffocating all night long. So you're going to wake up feeling unrefreshed. You might wake up with a headache. You may feel excessively sleepy during the day. A lot of people, in women particularly, although this is a men's summit, they may have mood, mental health issues, depression and things like that. We see that in men as well. So those are common, the most common symptoms you would see. Now, in central apnea, that gets a little tricky because you might not necessarily have very overt symptoms. You may have brief pauses. There's certain people with certain risk factors, like people who have heart issues that may be at risk for central apnea, or certain people who are on certain medications. So people that are on opioids or chronic pain medications may be at risk for central sleep apnea, again because it's their respiratory system may be a little bit downgraded because of the medications they're on. But I think really for the sake of this summit, really focusing on obstructive sleep apnea, that's really where we see a lot of the more impact.
Absolutely. It brings to mind an interview that I did here on blackdoctor.org with Barry Sanders, the NFL legend. And he mentioned that he was told for so many years that he snored. And he's like, I didn't believe anybody till somebody recorded it and he played it back. And he was like, oh, are you sure that's me? So that definitely is, I'm thinking about a lot of other people that I know that snore. But Dr. Washington, what should someone do if they think they or a loved one may have sleep apnea?
Well, the first steps are to consult your primary care doctor, and the doctor can perform an informal set of questions to get an idea of how tired you actually are. How easy is it for you to fall asleep when you're doing usual kind of day activities? It's unusual for a person to not be able to watch a program in the afternoon because they fall asleep, or if they're eating, to get tired after lunch. How easy is it if you're reading something that you would fall asleep? They ask these kinds of questions to determine how much fatigue do you have, and would it be worthwhile the expense, it's usually covered by insurance, of doing a home sleep test in order to make that diagnosis. Very often, physicians, primary care doctors, they will refer to a sleep specialist like Dr. Brown, and Dr. Brown may ask the patient to come into the office for one of the sleep tests that they do in the lab, or they may have the home sleep test that can be done conveniently over the course of 3 days. Does that make sense?
It does, absolutely. So, what are some of the major risk factors for developing sleep apnea, Dr. Washington?
Well, you had asked what types of sleep apnea are there. I think when people can think about sleep apnea, think about problems breathing when they're asleep, what they're really are thinking about is a blockage somewhere between the nostrils and the throat, where what we call the windpipe, right?
Mm-hmm.
So the idea is, I don't know if you've ever tried to sip a drink through a wet straw, but as you sip, the very act of sipping causes the straw to collapse.
Yeah.
So the idea is that as a result of weak and fatty tissues and thickened throat, neck, tonsils, even if your nostrils are congested during the night, it can lead to a collapsing. And as a result, depending on where the collapsing and blockage is, that's the kind of treatment that would be considered. So it can be anywhere from causing you issues with snoring to a complete blockage that prevents a person from breathing for 20, 30 seconds or more. So when a person is seeing a video like Mr. Sanders saw, or when your family sees the kind of difficulty you're having breathing, that doesn't look good. It's a far cry from looking at a baby and, oh,
Right.
that's good. You can barely tell they're breathing. It's gentle. It's almost pleasurable, right? And they're having the opposite. And so that would tend to make them want to get in touch with their doctor.
Okay. I did see a comment. Robin Thames says her husband told her 6 years ago, but he that she snores, but he also snores. She says now they sleep in separate rooms, but sounds like they both need to go get checked.
Yes, I would say there's actually an entity people talk about in the sleep world called sleep divorce. That's really it. Where couples are just like, you know what, for the sake of the sanity of this home, we're just going to sleep separately. We'll still do everything else together, and we'll go to our sleep separate places. I don't think that's a great long-term plan. I think finding the root cause rather than just silencing each other's snoring is probably more ideal.
It's basically denial. It's if you see someone sick,
Yes.
and then you decide to turn your head, right?
Yeah.
They're still sick. They're still
Right.
sick.
Right.
Yeah.
Let's see. I think she may have commented again. Oh, so Andrea Tobias wants to know if sleep apnea can affect any other body systems. Do either one of you want to take that question?
Yeah, I mean, I could take that on. So I really think right from the top all the way down, there are so many systems that are affected. Because if you think about a situation, again, the way I try to get people to understand the seriousness of this, imagine every time you go to sleep, someone literally puts a pillow over your head. That's what's happening. You're suffocating. And so what does that do? Your brain goes into fight flight mode because your body starts to sense that oxygen is not coming in. You're supposed to breathe in oxygen and breathe out carbon dioxide. So that triggers stress hormones, cortisol, and other hormones, which we know when it's persistently high in our system can cause a lot of downstream effects. One is your heart is feeling like, I'm not getting enough oxygen. Maybe I need to beat faster. And so you start to see that the heart becomes under a lot of strain. And we may start to see things like hypertension, We may start to see things like abnormal heart rhythms. We may start to see, even things like heart attacks. That's high in people who have sleep apnea, again, because of all the stress that your body is going through. So that's just the heart. We also have a higher risk of strokes because of untreated sleep apnea. And then in terms of just the brain function, imagine just feeling like you're living in a brain fog because, again, you're in that state where you're not necessarily getting restful sleep because your sleep is disrupted. So that can lead to, long-term memory issues, Alzheimer's and things like that, mental health issues, because you just feel so sick and unwell all the time. So irritability, anxiety, depression, and things like that. And then there's also our metabolism, right? Overall, if you have high cortisol all the time, your body feels like it needs to put out more sugars. You can start to develop what we call insulin resistance, and that can potentially down the line lead to diabetes. In addition, there's abnormal hormone regulation because your metabolism is affected, which can then lead to things like obesity. You may start to find yourself craving more energy, and we look for energy containing foods like fast foods because, again, you're so tired. And so that can start to lead to that uptrend in our weight, which can contribute to obesity. And we know all the consequences of obesity. So again, you can see right from top to bottom, it can impact. For men, the studies show that obstructive sleep apnea, if not treated, can lead to a decrease in testosterone. We all know we don't want that.
Right.
So again, we can see there's a whole lot of things that could go wrong when we don't address sleep apnea.
Mm-hmm. I hate to refer back to Mr. Barry Sanders, but he also, during that same interview, mentioned that the only reason he realized he had sleep apnea was because he had a heart attack. And then they did a sleep test, and it was because he had sleep apnea. So, yes.
It's odd that it had to come to a heart attack before he could listen to the people who love him to tell them, no, I think I'm okay. And the idea is that we feel okay because we're asleep. Very often what I ask people to do in the office, or to those people who are interested in knowing, is to blow out your air and then hold it. And after 10 seconds, that's what sleep apnea means, you will start to feel what sleep apnea feels like. So I invite everyone listening now, just blow out your air and hold it. So that's about 5 seconds.
Yeah. Wow.
Well, the idea is after a few seconds, you start realizing, I need to breathe. The fight or flight that Dr. Braun was talking about starts to kick in, except you're asleep. So you don't know about it, and you can deny it the next day. Basically, it only makes sense to everyone. If you don't eat enough food, if you have malnutrition, it affects every aspect of your health. If you don't have enough water, you can get by, but it affects your health.
Right.
If you don't have enough air, it affects your health. It affects every aspect of your health, as Doctor was saying, from high blood pressure to insulin resistance and diabetes. It affects mental health disease. It causes people to be irritable and moody the next day, except they don't know it, right? When we talk about hangry, we all know that term now. The person is hungry, but they act angry. The joke is they're the only one in the room who doesn't know it. Their friends go, hey, man, you need to eat something. No, but and then they eat. Oh, I don't know what that was about. I'm sorry. Well,
Right.
I call it tranky. When a person's tired,
Oh.
they're tripping because they're making a little thing. And if they could just, and you know what? That's what's wrong with and I don't know what. Man, come on. And they're cranky. They're tranky. So it affects mental health and anxiety, and it causes depression. It makes people make mistakes. Overreact to the children, to not be present, in addition to all the disease and that, like low hormonal changes in women and men. Yes, every aspect of health is affected by a lack of the most fundamental, the most fundamental, oxygen. You need to breathe, and sleep is the second most fundamental.
I'm going to use that Tranky. I like that one. Thank you for that one. I'm going to use that.
First time you use it, give me credit, and then you can
I
have it.
will, absolutely.
Yeah.
I'm going to refer people back to this video so they can see.
And I think one thing that we should not even forget is the public safety piece, right? A lot of
Yeah.
what we're describing is something that affects you as an individual. If you don't
Mhm.
address your sleep apnea, it does affect your loved one. Because I mean, I didn't realize going into this field I was going to become like a marriage counselor, literally, because it's spouses dragging their husbands and wives into my office saying, "Fix this, otherwise I'm out," right?
Yeah.
So there's that, but there's also public safety. One of the things we know, one of the many most common reasons for road traffic accidents is drowsy driving. And so again, imagine that you're being up, pretty much your brain is up, even though you're sleeping all night long, trying to keep you awake. You will be sleepy during the day because you did not get any restorative sleep. And a sleepy driver is the same, if not worse, than a drunk driver. And we have statistics to show, like, thousands of road traffic accidents related to drowsy driving. So that public safety is also
Mhm.
a big one that we need to be aware of when it comes to not addressing your sleep apnea.
Yes, I agree with that wholeheartedly.
Well,
Uh,
what are
most
the
sleep Most accidents happen in the late afternoon, 5 o'clock, when people naturally have a lull, and compound it with the sleep debt of not sleeping well. Yes, and there are many studies that indicate that 1 hour of missing sleep, and a person will drive their car as if they've had one drink of alcohol. They can drive it straight, but if something were to happen that they need to make a decision, that they need to put on a brake, then they operate the vehicle as if they've had alcohol.
Hmm.
wow? Well, what are the most effective diagnostic tools? Because I think earlier we mentioned sleep tests at home or in the lab. Can you talk about the difference of those? Um, well, both of you actually. Can you talk about which one? What is a sleep study? What is happening during a sleep study, and then in the lab, and then what are we doing at home if we decide to do it at home?
Dr. Brown?
Yeah, absolutely. So I'm in my office now, so I get to do a show and tell. This right here
Yeah.
Oh,
is
cool.
actually a sleep study. This is a type. So I want people not to be afraid. The technology has advanced so much that you cannot, and they're quite affordable, most times covered by your insurance. You cannot afford not to get this done. So we call the test we use to diagnose sleep apnea is the sort of the gold standard before was what we call the polysomnogram, right? It's a polysomnogram, meaning multiple channel recording of sleep. And there are two different types. There's the in-lab study, which is done in a lab. So I usually call it like maybe a 1 or 2 star hotel where you come, you spend the night. There are different stickers on your head to measure your brain waves. There's a nasal cannula to measure how oxygen is flowing. There's some other stickers to see what's going on with your muscles. There's a pulse ox, which measures your oxygen, and then there are belts, because we want to see as you're breathing and you're making effort to breathe, are you getting air in? Is there a blockage and things like that? So lots of stickers, lots of things. A little bit more intimidating for most people, but it is very, very accurate, right? So that's the typical one. But with advancements, we now have a lot of technology where the home sleep test is done similar kind of thought pattern as an in-lab study, but less cumbersome. So for instance, you don't have the whole EEG thing. You may have a few channels that are not present. And so while it cannot diagnose all sleep disorders, which an in-lab study would do for most sleep disorders, a home sleep test will absolutely diagnose obstructive sleep apnea. So again, you have what you call the flow based. It may just be like a nasal cannula and a couple of belts and then a pulse ox. And then we have a different type. It's called the PATS technology. So this is just one of them. You literally wear this watch. You put on this as a pulse ox. And then there is this goes to around this area. So it can monitor your position. It can monitor snoring. And this is it, guys. You wear this, and then you would wear it for either a night or two. And then this is it. This is the sleep study. And then once that is done in the morning, you get the data uploaded into the cloud, and then it is read by a board certified sleep doctor, and you have your diagnosis. you have your diagnosis. And then based on that, we can determine if it's mild, if it's moderate, like Dr. Washington said, or if it's severe. And then we can now start to talk about what the treatment options are and things like that. And so there's even other technology. I don't have that here, but again, that there's enough support and accessibility now with the home sleep test that it should be done.
Thank you for showing. I love props because I know me, I was like, I'm not ever doing a sleep study. I don't want to deal with all that. But that looks so like just not at all what I had in my head. And so I appreciate that you showed that. And I think the audience appreciates that too. I love that it's just that watch and, just a couple things and that's it.
Yeah, there's so many different types. Some of them have the flow base. This one doesn't have the flow base, but again, it's not as intrusive as people think it is.
Yeah. So are there barriers, Dr. Washington, like cost, stigma, or access that keep people from going to get the test? Once you say, okay, I want you to go have this test, do you think there's any barriers to why some people just don't do it?
Well, there's always the barrier of denial, which is people want to believe that they're healthy and nothing is wrong. And so if it's not fixed, it's not broke, don't fix it, leave it things alone. I don't know the cost. You can get the home sleep test for $250. Most insurance pays for it, as Dr. Brown indicated. So that need not be. But the idea that I snore or that I make noise or if somehow I'm not normal, people don't want to take on that kind of idea and get it treated. But the stigma, it can be an issue. The idea, though, is that if people will do for their families what they won't do for themselves, and so when they think that maybe I could be more healthy for my family, that can be a way to get over the barriers that people have from getting help.
Okay. Well, what are the treatment options, Dr. Afolabi Brown? I know once they've got the data and they've got the diagnosis, then what? How do you treat sleep apnea?
Yes, I would say, previously there seemed to be only one, and I have a few props here for that too. When I'm in my office, I love doing these interviews because then I could show and tell. But I think the first step is conversation. Have a conversation having the conversation with your doctor, right? How severe it is, what does it mean, and then set goals. The goal is that we're able to restore breathing during sleep and connect it to what's important. I want to feel better. I want to not feel so sleepy. I want to not be irritable to my spouse or my kids. I want to be alive to walk my daughter down the aisle for her wedding, right? Like set goals to help people see that connection. And then we start to talk about the treatment options. Usually it's based on the severity. So for instance, for mild, some people will say if your symptoms are not very significant, maybe some more conservative measures can be used. I think regardless of the number, which is the apnea hypopnea index, which is really how we characterize the severity of sleep apnea, more importantly than that is your symptom. If you're feeling very sleepy and I tell you have just 14 or 13 apneas an hour, for me, that is significant enough as if you had 40 events an hour, right? So it's really important to look at what the symptoms are. So the number one treatment that we know that's been around for decades is CPAP. That's the continuous positive airway pressure. What is that? It is literally taking a compressor, which is really a very, very small portable device that just blows air through a tubing to the back of your throat. And I'm trying to find my tubing. Here we go. And so this, for instance, is the tubing, right? And so this is connected to a machine. This tubing is usually much longer than this. And then this is the mask. And you have different types of masks. Many people are scared about looking like Darth Vader. There are some Darth Vader looking masks. And then there's some like this, very minimal, very unintrusive. And so essentially you would wear, this is another type of mask. It's called a nasal mask. You would wear that mask over your head, right? This is, you can see, very super, super soft. And then this is connected to the machine through the tubing, and it pumps air. It's not oxygen. You won't get addicted to it or dependent on it, it pumps air to the back of our throat. Because if you think about what we said, if you have apnea, your airway is collapsing. So it literally just pushes air to the back of your throat. And we have so many different, this is a full face mask. So this is what the mask looks like. So you just put it on, and then it's attached to the tubing to, the CPAP, which you put on your bedside table. And now your brain doesn't have to do all that work of feeling under stress because you're not breathing. The airway is nice and open. Think about if you have a flat tire, you pump it with air. That's all it is. You wear it at night, you wear it through the night. It takes some time to get used to. And then after that, it's life-changing. People say, it's changed my life. That's what people say. I've seen people who are on multiple medications for hypertension stop needing their hypertension medication. I've seen people who have diabetes have better sugar control. I've seen people who are on medications for depression get better. I've seen marriages repaired because of it. So it's crazy how effective this is. So again, don't be scared. You don't, even if you look like that Vader, you can breathe now. Look at that. It is so, it may feel clunky, but it is so soft. And the technology, again, is advancing so quickly. And so that's CPAP. Again, I'm spending a lot of time with that because that's the most common and the one that was very effective. Now, if you're someone who maybe you've worked with your doctor and you cannot find a way to get used to wearing that CPAP and you're like, I cannot tolerate it for the life of me. And then there are other treatment options. Usually if you have a mild or moderate form, and one of them is an oral appliance. What's an oral appliance? It's a device. It's not the same as a mouth guard. So please don't go on Amazon and just order a mouth guard. No, that's not the same. But that might actually make your sleep apnea worse. It is a fabricated and customized, in some situations, a fabricated and customized mouth guard that is really devised for you. Think of it like Invisalign. So this is really the oral appliance. So this is what it looks like. So you can see you would put that in your mouth. It has these little bands. And so those bands are sized. And these bands is really what you use to move your jaw forward. Remember, we said your airway is collapsing as you're sleeping. So this helps to move your jaw forward. And so that way, you can see there's an advancement, right? So this is normal, and then it moves it forward a little bit. And so now if your jaw is forward, it creates less of a collapse. So this is another well-tested, well-validated, and effective solution. And then we have other things like weight loss, right? So for many people, one of the risk factors for sleep apnea is obesity or being overweight, because that really leads to, a wider neck, more fat deposit in the tongue and in the neck, and that causes more airway collapse. So losing weight has actually been shown to effectively decrease the severity of your sleep apnea. And there's actually now an FDA-approved medication, the injection. So one of them is called tirzepatide or Zepbound. It's actually been FDA approved specifically for treating obstructive sleep apnea in people with obesity. So if you have a diagnosis of sleep apnea and you have obesity, maybe your BMI is above 30, you can ask, your doctor can actually write that prescription for you to treat, of course, the obesity and also to treat the sleep apnea. So again, options. Another type, if you have very mild sleep apnea and they notice that your sleep apnea is worse in certain positions, then we do what we call positional therapy. So this is really avoiding sleeping on your back. So literally it's a behavioral therapy where you train yourself to only sleep on your side. I tend to see that more effective in people with more of the milder form of sleep apnea. And then there are a little bit more aggressive treatment options like surgery. So there are different surgeries, either jaw surgery, maxillary expansion, where you work with an orthodontist or a jaw surgeon. And then also what we call the Inspire therapy. This is think of it like a pacemaker that kind of stimulates the back of the throat to cause contraction and keep that airway open. So those are some of the types of treatments available.
Thank you. I've never seen a CPAP machine, so thank you, or any of those things. So thank you for walking us through that. You mentioned weight loss as a lifestyle change. Dr. Washington, are there any other lifestyle changes one could make to help manage or prevent sleep apnea? I don't know. Is there anything?
Well, when I think about snoring and sleep apnea, I think of it on a spectrum of severity, from very, very common. It's very common to snore, and it's also very common to have sleep apnea, at least some stopping of breathing. And so the way to understand it is that it seems that anything which incapacitates us and our ability to thrive and survive makes snoring and sleep apnea worse. So if you have a cold, you'll have more snoring. If you're
Mhm.
overtired, you'll have more. If you had a very busy physical or emotional day, it's more likely that you will snore and have more sleep apnea that night. If you have alcohol that incapacitates you or other drugs, um, it will increase your snoring and sleep apnea. Um, when we have a lifestyle that's caused us to be overweight, to have increased fat and thickness of the neck, it causes us to have more sleep apnea, especially if the tongue falls back into the throat while we lay back. That laxity or lack of fitness of those muscles tends to let the tongue fall back. So when the sleep study shows that, for example, the amount of snoring and sleep apnea is greater on the back, so it tends to be positional, then using those positional devices, we used to use a tennis ball that was sewed into the back of the pajamas. Now we have vests and wedge pillows that tend to keep a person on their side and onto their back. Those are the kinds of lifestyle adjustments. If a person has nose congestion, many people, when the air is too cold, they get more stuffy, or if it's too warm or dry. And when they lay down, certain foods make them more stuffy, that's a lifestyle adjustment that could be. But essentially, the more fit a person is, the less likely they'll have snoring and sleep apnea. And think of the babies as the most fit, right? They
Right.
do well. And as we get thicker and older and take on things like drugs and alcohol that interfere with our fitness, we have more snoring and sleep apnea.
So can sleep apnea be cured, or is this just something you've just managed? Unless you have surgery, is it just something that you just manage, Dr. Afolabi Brown?
It actually can be in some situations. I think this is really, really where I feel like many of us within the medical field are going towards, right? That kind of root cause, addressing root cause, right? Dr. Washington said, like, if you're able to address more of those lifestyle issues, sometimes that's it. If you have, like for instance, very mild sleep apnea that may be due to allergies or some nasal obstruction, you might see an ear, nose, and throat doctor. You may need to get, if you have a septum that's deviated, you may need to get some surgery or some sinus surgery or treating the allergies. You just treated your sleep apnea. If you have someone who is overweight and we feel like the weight is what's really driving the sleep apnea, if they lose a certain amount of weight, it is absolutely what, and I would say for you out there, if you had a sleep study and you were starting on CPAP and you've been consistently losing weight, usually we'll say if you've lost anywhere from about 10 to 15% of your weight, it's time to get another sleep study because you may see a decrease enough. In fact, the research that they did on Zepbound when they were looking to get the approval, they found that up to 50%, if not more, had resolution of their sleep apnea by just losing weight enough. So that's a cure technically, right? And then, in some other situations, it may end up being a lifetime thing, but it's all about seeing, can the root cause be addressed? If the root cause can be addressed, then there's a potential that it can be cured. Now, most people who are on CPAP end up, requiring it for many years of their life. But I think it's definitely worth exploring what's the root cause. And sometimes you might be able to identify a root cause. Sometimes you might not.
Absolutely. And I was just thinking, like, when Dr. Washington was mentioning eating certain things, I'm like, for me, it's dairy would cause the congestion. Cut that out. That helped. Had the deviated septum fixed. So yeah, those things do help with the fixing the snoring. I don't think I snore though. I'm kidding. I'm going to get a sleep test. So as we wrap up, and this is for both of you, what advice do you have for someone that is either afraid to go get tested or they have been newly diagnosed with sleep apnea and they are afraid of all those things that the different treatment options, they just want to just ignore denial. They just want to be in denial. Dr. Washington, I'm going to start with you.
Well, I think it starts with what you want.
Mhm.
So
Yeah.
what I say to people is that there's probably a time when you're with your family or friends and people are getting along and you suddenly look and you think, wow, this is a great moment. Or when you're near the ocean and you smell the air and you think, wow, this is good. I feel alive. I feel alert. Life is good. Well, my experience has been that when your sleep is better, you have more moments like that.
Mm.
You feel more alive. And if that motivates you to have more of that with your family and friends, then it can motivate you to take care of the issue that is concerning you. I remember when I first started wearing glasses and I put them on, I was looking around them and I had these things on my nose. And yeah, it takes a while to get used to things, but we can do it. And I think that having a motivation to feel well may be enough.
Absolutely. That's a great answer. How about you, Dr. Apalabi Brown?
Yeah, I mean, I think this that was so well said, Dr. Washington. I would say, yeah, lean in with curiosity and be willing to look behind the curtain. I think people do not want to get tested because they're so scared of what that would mean. They don't want
Mhm.
to wear a mask all the rest of their lives. But like you see, there are actually options. So be empowered to have options, and knowing the consequences. And these consequences, these risks are higher in our Black population, in men as well. They are most frequent, 2 to 3 times more likely to have sleep apnea than their white counterparts, and have this high risks of all these health issues. So lean in to say, what happens if I take that extra step to look what's behind the curtain? Just be curious, and say, what if I get tested? What does it mean? Or what if I just lean in and at least give myself an opportunity to find healing? Because right now, probably what you're doing isn't working. And so it's time to explore what's other alternatives.
Absolutely. Thank you. Thank you both for coming on and sharing your knowledge and bringing props. I love props. Thank you for bringing that. I saw some people in the comments saying that also helped to be able to see those devices and think about what may work for them. So
Yeah.
this has been such a great conversation. I wish we could continue it and have part 2, 3, 4 because we could talk all day about definitely about it all. Let's see. So, for more information on sleep apnea and other sleep disorders, you can check out our website, blackdoctor.org. There's lots of articles and resources there. And up next, we are shifting gears. We're going to talk about another silent threat because this one was a silent threat, and this is another one for Black men: high cholesterol. And so, we're going to be talking about what every man needs to know to protect his heart. So, stay with us for more expert advice, real talk, and practical tips because this is the 5th Annual Men's Health Summit on blackdoctor.org. I'll see you guys in a few. Thank you again for joining us.